do every single day with my patients, so about 20 times a day I'm giving some variation of this talk. So Bismillahirrahmanirrahim. It's about heart disease prevention, and I think there's a lot of implications from the standpoint of what Islam teaches us around just general health, but even what Islam's concepts are around heart health. Usually when we talk about heart health in Islam, we're talking about it on a spiritual level, and we're talking about how to keep things like stress. It's mainly sort of its implications on stress management and what kinds of things that stress can actually do that's harmful to us. And probably when it comes to a lot of just hormonal influences of adrenaline and cortisol and those things that we know are stress hormones can adversely affect our health as well as our cardiac health. And as we kind of walk through just traditional risk factors for heart disease development, we start to learn how much overlap there is in Islam and how Islam actually protects us from the kinds of diseases that we commonly look at every day. So with that, I was going to start with a hadith. So in Sahih Bukhari, there is a hadith that goes like this, that indeed in the body is a lump of flesh, and if it's set right, the entire body is set right. And if it's corrupted, then the entire body is corrupted. And verily, it's the heart. And we have this idea that our sort of consciousness, we think about that as being in our brain, but it may actually also be part and parcel within our heart. And the way we make kind of our decisions, sometimes we sort of separate it almost into cerebral decisions and things that we refer to as our gut or our what's deep in our heart. So we already have a little bit of an awareness of how there's a bit of a separation between what always is a logical way of thinking compared to what deep down inside we feel that we refer to as our heart. We think of heart disease as sort of things that we're either born with, that the heart may have some abnormalities just by birth, but most of what we talk about with heart disease is things that develop later in our life, that evolve. So I wasn't so much going to focus on things that we might have been born with, and there's a lot of different abnormalities that can happen by birth in terms of birth defects, but those aren't the ones that we have a lot of control over preventing. But heart disease being as prevalent in society as it is, there are a lot of things that we are able to do from a prevention standpoint that's important. And that's really what my focus was going to be. We kind of think of cardiology as separated into plumbing and electricity. So there is a set of diseases that go along with the electrical system of the heart, which governs our heartbeat and dictates how steady our heartbeat is, how it responds to our environment and knows that if we're going to be doing something physical, it's got to speed up as appropriate and slow down when we've stopped running or doing our exercising. And occasionally that there are some short circuit type phenomena that happen that set the heartbeat into a fast, unnaturally fast mode. And those kinds of electrical disorders are treated with certain medications, and there are also techniques where the electrophysiologists within cardiology actually find where the abnormal pathways are and deliver intentional burns or freezes to that part of the electrical tissue to stop the abnormal heart rhythms from happening. Then there are other diseases of the heart muscle strength, and that can be That can arise from things like viruses that we might acquire that might just be a cold virus, for example, and over time, as our immune system tries to fight off those cold viruses, there can be some cross-reactivity with certain elements of our heart muscle to actually weaken it several weeks or months later. And those are often treated with medications. Those kinds of heart muscle weaknesses are sometimes not responsive to medications, and then we go on to talk about things like heart transplantation to try to treat those. And then the heart's anatomy includes pumping chambers, which are the 4 chambers within our heart, but also valves that separate those pumping chambers. And there are intake valves, and then there are outflow valves, so that the blood continues to move in one direction through the heart. And then people can get abnormalities of the valves themselves that can render the valves either leaky or render them narrowed and sort of thickened and degenerated so that they don't open as widely as they should. And some of these valve diseases come from, again, certain infections that can create, again, like an immune response with the valve and degenerate it faster. Other times it's a wear-out phenomenon. You know, subhanAllah, these valves open and close with every single heartbeat of our life. And the best of the mechanical valves, or even the tissue valves that are implanted, might last maybe 10 years, maybe 20 years, maybe 30 years. But our God-given valves usually last our lifetime. So it's amazing that, subhanAllah, they have that kind of life to them. But occasionally they do degenerate and degrade as we get older from various things that affect them. And then we have to talk about how do we optimize the valve function and ultimately perhaps even cut them out and put in new ones. But the biggest killer for humans in North America is actually what affects the blood vessels that feed the heart muscle itself. So the heart, being a pump, needs its own fuel supply for delivering the right amount of blood flow coming to it so that it can do a good job. So it needs its own nutrition, it needs its own oxygen supply. And when it's made to work harder, it needs more. So our arteries have to be ready to deliver that blood flow to the heart muscle when it increases its demand and wants more. And those arteries that feed the heart muscle with blood are usually about 3 to 4 millimeters in caliber. So they're very thin, and they are prone to developing fat and plaque and gunk that lands inside the arteries, kind of like rusty pipes, over our lifetime. And that can go on to cause an obstruction within the arteries themselves so that the blood flow can't deliver to the heart muscle like it needs to. And when that plugs off, that is what is called a heart attack. So a heart attack happens because the muscle of the heart that wants more fuel coming to it all of a sudden can't, because the artery that's bringing blood to that part of the heart muscle isn't able to deliver. So that's probably, when we talk about heart disease in general, is probably the biggest aspect of heart disease that we talk about when it comes to prevention. What can we do differently to keep that from happening? So just to give you a perspective, we talk about 1 in 4 Americans dies of heart disease, and 1 in 3 women dies of heart disease. So we're talking about our biggest killer, and it's the leading cause of death for both men and women. And per year, 720,000 Americans are diagnosed with a heart attack. And more than 1 in 3 women who is living with heart disease, and half of the African American population of women, and 34% of Caucasian women. So there is a large burden of disease amongst women especially. So just kind of from an anatomy standpoint, Our heart, which is the pump, is about the size of one's fist, if we're kind of thinking about how big is it, and it sits right in the center of our chest, with a little bit of a sort of pointedness towards the left side, so that the tip of the heart is pointing towards the left. And this side sits actually right on top of the diaphragm, which is the muscle that separates our abdominal cavity, or our stomach really on the left side, from our lungs and our chest cavity. And the arteries that we're talking about are the ones that sit, they come right off of the aorta. So the aorta is the red tube that the blood is pumped into from the heart's chamber. And the very first arteries that branch off from the aorta are the coronary arteries, or the ones that are feeding the heart muscle itself. And those two coronary arteries start off sitting on top of the heart, and then they send branches, and the branches are sent down into the heart muscle. And the heart muscle gets its blood supply from the branches that are sort of making their way into the heart muscle itself. When we talk about blockages, oh sorry, go ahead.
I want to go back to the slide before we were talking about the rates of heart attack. You said 1 in 3 women die of heart disease.
Yeah,
So is there, do you know why that's the case, the correlation is?
So I think there's a number of different things to keep in mind there too. I think the coronary artery disease sort of being our biggest vascular disease manifestation affects both men and women in a pretty substantial way. But there are a number of ideas around how it seems to affect women in their older ages even more so. We see women generally living longer than men, so we have that sort of a skewed statistic. Women being a little bit more petite in size will tend to have even thinner coronary arteries than generally men would. So as our age advances, it is easier to start having narrowings develop within a smaller caliber artery that has a bigger impact in blood flow delivery. There is a whole big idea around how we seem to have a lot more women caregivers as we get older that almost keeps them from seeking help for themselves when they are looking after other people. And so by the time they come to becoming diagnosed with their problem, it is already pretty advanced, as opposed to society already kind of encouraging the male counterparts to go in and seek help if they're feeling any type of symptoms. And then from the symptom standpoint, interestingly, women generally have a little bit of a different pattern of presentation than men do. So when we talk about what kinds of symptoms, which we'll get to as well for heart attacks, men tend to have a little bit more of a typical pattern, so when they do get symptoms, it becomes easier for them to recognize that it might be their heart and they should go in and get it checked out. And usually it's almost on the encouragement of their wife who says, go in and get checked out, you don't look right. Whereas women's presentations tend to be a little bit less typical, so that by the time they come to diagnosis, they're looking at a little bit more advanced disease. There's probably like a multitude of factors that predispose women in their older ages to have a little bit of a higher statistic. So just as a visual in terms of the arteries, so the bottom three are like a cross-longitudinal section of our artery system. And when we don't have any narrowings, it looks nice and clean. When we begin to develop narrowings and plaque within our artery system, there's still some blood getting through, but you can see how it starts to build up. And finally, when it builds up enough, you've got a complete block-off of the arteries that blood flow can't get through. And there's a number of ways that that happens. Intuitively, we think that it's going to be from plaque that grows and grows and grows until it shuts down. But actually only a smaller portion of patients' heart attacks happen from plaque that grows and grows. Rather, most of them happen where the plaque is not obstructive. It might look like this, maybe even thinner than that. But as a mechanism of trying to heal the surface of the artery, we suddenly try to form clot on it. And it's kind of similar to when we cut our skin and blood that oozes out realizes that it's slowing down, and then there's an incentive to form a clot. Well, then the clot forms a scab, and then you heal all the skin underneath and it flicks off. In the artery, it's actually trying to do the same thing. So it's getting the same signals that there's a disruption in the artery wall, and I got to do something to heal it, so it forms a clot. And the cholesterol goo, which is like the fat goo within the artery plaque, is actually a very powerful attractor for clot formation. So it's a powerful chemical attractor to make clot. So you hear about people who have suddenly, without any symptoms, having a heart attack. It's usually a process where clots suddenly form and the artery shuts down. So not just the presence of plaque is concerning to us, not just the plaque growth is concerning to us, but any plaque presence becomes concerning to us from a treatment standpoint. So what are some of the risk factors? We talk about sort of 6 big risk factors. Smoking, as everybody's heard, those of us who were kind of seeing the evolution of smoking saw that back in the 70s it was actually really common. Doctors smoked. There used to be like ads in magazines from doctors who preferred Camels. And I remember going to the hospital with my dad just to kind of accompany him, and the doctors' lounges would be filled with cigarette smoke, and all the nurses used to smoke. And it was absolutely a time when nobody realized that it was bad for you. And then, probably by the mid to late 70s, the Surgeon General had enough data to tell people that this was bad. These are all the bad things that were happening from it, and heart attack was one of the top ones on the list, including cancer. So as soon as we began to realize that it was bad for you, the cigarette companies turned their attention to all the other countries of the world and hammered with advertising cigarettes in China, in India, in the Middle East, and in all the other parts of the world where we now see smoking as being a huge addiction. And I think there was a headline not 2 or 3 days ago where they're anticipating 1 in 3 Chinese males dying from a cigarette-related condition. That's their statistic currently. It's just staggering. And it's unfortunate, but that's where the companies are making their money now, where North America's incidence of smoking has gone down. But it's a huge sort of public health concern.
Another thing I'm curious about, nowadays things like hookah and e-cigs are very popular, especially with younger generations. Are there correlations with that and also lung disease or any adverse health side effects?
Sure, and I think to some degree we're still learning as a community because nobody's had a really widespread experience with it. But it was my understanding from talking to pulmonary docs that the e-cigarettes and the newer kind of vapor-based smoking systems may potentially have certainly other aspects to it, but may also be equally bad. And part of it is because some of the systems still involve addictive substances like nicotine. And it could just be that our usual carcinogens are just being replaced with other ones. And we just don't have the experience yet to say. And of course, it's always going to be a little bit relative, but I think when it comes to addictions, going back to what Islam recommends against, it would probably be widely recommended, just even amongst the medical community, to never start and to stay away from such things because, you know, just like the cigarette experience, nobody recognized how bad it was until it was almost too late. So that's probably going to be a similar story with these newer agents.
You put hookah in that category.
Yeah, I would probably do that. And I'm not sure that I've ever really seen a large enough study, and if anybody knows differently, let me know, but to kind of really look at the public health aspects of that to see whether, what kind of bad things are we seeing coming out of it. So the other big sort of risk factor that's appreciated that's smoking related, we always think about it as our own personal smoking history, but in fact, secondhand smoke has become widely recognized as being bad. So, for instance, I don't know if you guys might have remembered about asbestos, for example, where people who came home with their clothes with asbestos fibers in it because they were doing construction work, they would give their clothes to their wives to wash, and the wives would like shake out their clothes, and then they would ultimately get lung cancer from breathing in the asbestos that was just shaking off their husband's clothes. So similar to that, secondhand smoke, where people say, well, I never really inhale my cigarette, I'm just holding it and then it burns out. Even if it's just in the air, you're getting a significant secondhand exposure, and the carcinogens are in the air that you're breathing that's part of the cigarette smoke. And that if your exposure is before the age of 20, so if you grew up in a house where there's cigarette smokers, like parents or siblings, that the time that you were exposed as a child actually has more bearing in the future. So there's something intrinsic with the damage that happens when you're exposed as a child, even with secondhand smoke, that renders higher risk later on in one's life. So can never say enough about avoiding cigarettes as a risk factor. I think that there were some ideas around trying to make it even haram because of its bad effect. And so if Allah gave us our bodies to protect and preserve as if it's a holy place within ourselves to take care of, how do we do anything that's harmful to it? It's a body that we're entrusted with that we have to take care of. The second big risk factor is high blood pressure. It's called a silent killer because we don't feel it. A lot of the times we can't tell that our pressures are high. So whenever we go in to see the doctor, we should have them measure our blood pressure because that's about the only way to tell if it's abnormal. But it's important to recognize that many things contribute to it rising. And when it stays high for a long time in our life, it will ultimately be a big risk factor for creating vascular disease. And the kinds of things that contribute to high blood pressure are not always obvious to people. For instance, our diets these days have a tremendous amount of salt. They are salt-rich when we go out to eat. It's a very salty diet when we're eating in restaurants or we're eating processed foods. And even foods that are in cans have a large salt load to them. And there's a lot of thought around such salt-rich diets being contributions to high blood pressure in the long run. Our obesity epidemic in society is unprecedented. It's thought to be multifactorial, possibly from some of the things that we're eating contributing to that, but also a large inactivity component. They talk about needing about an hour's worth of brisk exercise a day, but with just the environment where parents are no longer comfortable letting their kids go out and play like they used to, most kids are growing up in a household where they're kind of sitting in front of a screen most of the time, and there are no formal exercise activities that are happening outside of maybe gym class, which usually doesn't last an entire hour. So inactivity contributes to high blood pressure. Weight when it's excessive, will contribute to high blood pressure. For birth control, estrogen preparations like oral contraceptives will contribute to high blood pressure. In the Pacific Northwest, we have huge caffeine intakes. Caffeine is a stimulant, and it might contribute to high blood pressure in some people. I feel like saying that I bet I can cut a half of a medical textbook and throw it away if we didn't have alcohol in our society. There are so many diseases that come out of alcohol and cigarettes, and Allah just protected us from the get-go, from our owner's manual of how we are to live our lives. We've protected ourselves from these huge influences that, you know, aren't just to our own body, but to our families and to our work environments. If one stops to think about how many days off people need from alcohol-related conditions, how much abuse might happen from alcohol-related conditions within family, that's both physical, that's also verbal, that is related to car accidents. I mean, I can go on, and I'm sure everyone knows about them. So another big contributor to high blood pressure. Many of the decongestants we use for allergies have compounds in them that will also raise blood pressure. You will recognize it as something called phenylephrine. It's a kind of nasal passageway shrink down kind of drug, and it feels great, but in those susceptible, it'll raise blood pressure. Sudafed, which thankfully you'd have to go to the pharmacist to obtain now because bad people make meth out of it. So before, you used to just be able to get Sudafed over the counter. Now you actually have to go to the pharmacist and get it from them. And they track how much they're dispensing to people to sort of try to regulate it. But it's another contributor to high blood pressure. There are certain hormonal imbalances that can happen from certain diseases that can contribute as well. In our older men population, where there might be problems with prostate enlargements that don't allow the bladder to empty properly, when the bladder does not empty, it'll raise blood pressure in those individuals. So it's important to get that checked out. There's a whole entity called sleep apnea, where people who are told that they snore, wake up tired, nod off easily in the daytime when they're doing quiet things, could have a condition where their oxygen levels will drop while they're sleeping, and that is a trigger for high blood pressure development in that individual. So things to get checked out. They also find that vitamin D deficiency in the Pacific Northwest is rampant. We don't have as much conversion of vitamin D in our skin, and D deficiency has been linked to high blood pressure, and also some medications. So when I say NSAIDs, that's a type of pain medicine that's pretty common. Advil, Aleve, ibuprofen, those are all in that class, and they're known to raise blood pressure as well. And of course, stress. So stress management, when it comes to our daily lives, can be improved upon by just observing our salah. There's so many programs now in these big companies that talk about mindfulness and meditation and yoga class at lunchtime or taking a walk. And I think that my rationale for having the longest salah in the middle of the day has to do with work stress management, to be able to take a time out, and that's our sort of meditation. And it's meditation plus, because while we're doing our salah, we're connecting with Allah, we're coming to peace with the stress around us as being part of His plan, and all of those things that help to just kind of our minds to chill. And then when we go back to our work with a fresh head, we're already working on less stress hormones. So we're given this intrinsic stress management program as part of our faith. High cholesterol is another big contributor. It's huge because it has a big diet component and it has a big exercise component as well. Things to know are that the saturated fat in our diet, which we learn when we read nutrition labels on the packages of things that we buy. If we try to minimize the saturated fat, we help reduce the cholesterol buildup in our arteries. There's multiple different kinds of cholesterol. The more we read about it, the more intelligent our questions can be when we go to the doctor to talk about our cholesterol levels. But in general, there's good cholesterol and there's bad cholesterol, and you want to reduce your bad cholesterol and improve your good cholesterol. There's contribution to bad cholesterol from alcohol, as well as from diabetes, and as well as from sort of red meat and dairy, which is all animal fat, and things like cheese, and things like egg yolks, and mayo that's made from egg yolks, and creams are all high-fat dairy that we should limit our intake of. And then there's a whole family history, so we should be aware who in our family has heart disease, what kind of heart disease, and if we learn that we had family members who developed heart attacks generally under the age of about 60, then we should be going in to speak to our doctors about how do we determine what our risk might look like, because a family history of early heart disease can be a very inheritable type of heart disease. So there are some ethnicities that are thought to be at higher risk.
Is there like a way to prevent getting high blood pressure?
Yeah, so typically those earlier things that we talked about that contribute to high blood pressure are just things that will contribute to it. And some people will have more of a contribution than others from any one of those things. So it's usually a matter of working through that checklist with your doctor to see what can I do that I might be overdoing, or if one of these contributors are a big player in my blood pressure. And then once they're identified, it just helps to control the blood pressure better. If somebody's really lucky and it's a reversible cause for them, they may be able to normalize it. But curiously, blood pressure only affects humans. There is one type of animal called the spontaneously hypertensive rat or something, which is what most of the data is like gleaned off of in terms of research. But high blood pressure doesn't happen to other animals, so we can't even really use a lot of animal models to research why do people get high blood pressure. And the most common type of high blood pressure, we don't even know why it happens. So it's not like it's a well worked out disease entity, but we do know what its effects are if somebody's left with too high blood pressure that's untreated.
Some of the things that I was told, just in general for young kids too, fast food, try to limit that as much as possible. Talk about sodium, so sort of salt, right? And a lot of fast foods nowadays are just packed with salt, like you said. Making sure you exercise an hour a day, which, like you said, a lot of people just don't do. You get out, exercise, make sure that you guys can share your time in outside. Don't just play video games all the time. It's always a good idea. And I think family history is pretty big too. My family had high blood pressure, so it's something that I keep track of. I do a pretty bad job with the salt because I love salt, but I'm working on it. But Sarah's laughing because she knows. But these are some things to keep in mind, especially for young kids.
And I think it's important to learn to read labels because it's so eye-opening. If you look at the sodium contents of some of the things that we're eating, when I was growing up, we never had nutrition labels. They are a recent phenomenon relatively, like I think probably in the 80s is when it really began to be on every food item. And so to have the advantage of being able to say, okay, here's how much sodium is in this box of mac and cheese, you really get to learn what kinds of things have bigger contents of sodium in them. And it's up to us to be able to limit our portion sizes. A lot of the fast food companies get a lot out of the size of portions that they give you. And most of them are such that we should be cutting them in half easily and saving the rest for another meal. Especially at restaurants, we should never feel like we have to finish everything on our plate. We could totally ask for a to-go box and eat the second half of that meal at another sitting. But to limit the amount we're taking in at any given time is a really important aspect to it, and circles back to what Islam teaches us about portion control.
Yeah, one more question about just food labels. So I know that on the sides they always say percentage of your daily
Intake, recommended, right?
recommended. And you know, there's some for saturated fat, and there's always some for sodium. It seems like the 100% mark, even for saturated fat, it's a lot of saturated fat. Is that really what we should be taking in on a daily basis, or should we be doing like 20% saturated fat or 20% sodium, not all the way to 100 every single day?
Right, and I think that that's a really important point. Unfortunately, I think the way our society is set up, that we probably, for our general population, probably actually exceed that. And it's a way of bringing that back under control. But when I certainly look at what the recommended daily amounts are, if you tried to meet those, it would actually be eating a lot more than what probably most people I know would consume. So it absolutely looks to me as well like it's something that probably ought to be rescaled. Maybe for our populations especially, because as we were talking about certain ethnicities have higher risk, the South Asian population and the Filipino and Far East population seems to have a higher risk. And our body sizes are smaller. Our kids are smaller. We know that when we go to the pediatricians and we look at the size charts, our kids are usually on the lower half of the size charts. And the pediatricians always say, well, you know, for your ethnicity, your kid at the 4th percentile is fine. And so, you know, I think for our populations, those amounts are probably more than they should be, and they're geared towards the larger 70 kilogram average man, which isn't even average anymore. They're all like 100 kilos.
Even then, the saturated fat that they recommend, that's like 4 Snickers bars a day.
Right.
It doesn't sound like a very good idea.
Right. Yeah. But, you know, I'm surprised at how many people tell me that their ice cream intake is daily. And then their cheese intake is a large portion size every day. So it adds up fast when you're talking about high-fat foods. Or their red meat portion sizes are every single day that they'll have red meat. So all of a sudden, it doesn't take much to get to those recommended allowances. But we really do need to rethink what normals are for people. And of course, these normals, even our cholesterol levels, the normal range is set by casting that out in society that we live in and bringing in everybody's cholesterol numbers and bell curving them. So that's how you define a normal cholesterol level. And yet, we're defining it in a society that kills 2/3 of its population with strokes or heart attacks. So we've got a huge vascular burden, and the way we're defining our cholesterol panel and its normal range is in a society where it's already scaled too high. So it's kind of a similar corollary to that, I think. And from all of those bad habits of not getting enough exercise and eating a large carbohydrate and salt intake, we are seeing an explosion of diabetes. So diabetes is a disorder of sugar metabolism where we're not able to metabolize the sugar in our food. And the main important thing to remember is that whenever we talk about limit your blood sugar, most people think about the sugar they're putting in their tea or their coffee. And it's actually not so much the sugar in your tea and your coffee, it's actually all of your starch that turns into sugar. So we only eat three things. We eat protein, fat, and carbs. And out of our carbohydrate, every last digested molecule is sugar when it's absorbed. And you have good carbs that are your vegetable-based carbohydrates, and you have your starch. And all of your starch breaks down to sugar quickly. So when we think about things that are pastries, flour, pasta, rice, potatoes, that's all very fast digesting sugar is how we absorb it. So compared to the 2 teaspoons of sugar in our tea, all of a sudden our plate of pasta is huge when it comes to our sugar load. And that's what we want to control. So what we grew up with was a food pyramid. Now they've totally rearranged that to what's a diabetic concept of a food plate. And what the recommendations now are that we take our plate and divide it into quarters mentally. Half should be our vegetables, a quarter should be our protein, and a quarter should be our carb, starch, which means that we can't eat our bread with our plate of pasta or our plate full of rice in our cultures. Now those are relegated to being a side dish on a quarter of our plate to now reproportion our healthy food proportions. So just to keep that in mind as well. So Islamic perspectives I just wanted to touch on was we talked about how smoking contradicts taking care of our body, that we should look to Sunnah in terms of our eating patterns. We should not be filling ourselves up completely. We should be eating in moderation. We should avoid excess. We should be doing a lot more sharing of our food. Is there an exercise benefit to Salah? Absolutely. I'm absolutely certain there is. Because if I take a glucometer and I test blood sugar after I've eaten a meal and then gone and done my Salah compared to not doing my Salah, there's a big difference in my blood sugar, just from that little bit of exercise. So don't discount the walk after dinner or the Salah, which usually falls after a meal, if you think about it. Most of our Salah times are after food. So there's already some pre-programmed things in our, what I would, refer to as an owner's manual for our body's health that comes packaged with our faith. We talked about, mindfulness and all of these seminars that people are paying for, and we get that automatically from our Salah when it comes to stress management. What are the benefits of controlling anger and all of the things that go along with reducing stress hormones if we train ourselves from childhood to manage our emotions and to practice our taqwa of holding on before we jump on saying something, processing before we immediately react to something, and just being able to have some management over our emotions. The benefits of stress management from just believing in Allah's plan. If we don't understand what's happening around us and yet we're at peace with it because we know that Allah has a plan around it, takes loads off just our worry level from that. I found it interesting that when we looked through sleep studies, when we talked about sleep apnea, there is a big difference between the smoothness with which we move air through our airway when we're lying on our back compared to when we're lying on our side. And you'll hear a lot from spouses who are married to people who snore, who say, well, I just nudge them until they roll over, and when they're on their side, I don't hear them snoring as much. And it's sunnah to sleep on your side. In fact, I think it's sunnah to sleep on one's right side, more preferably, which interestingly, if you think about the way our stomach empties, it empties to the right. So the stomach isn't sitting there like a bag in the middle of our body. It's actually off to our left side. So what we swallow goes down into the top of the stomach. It's sort of this kidney-shaped bag that after it digests, it empties towards the bottom on the right side. So maybe it helps to empty our stomach when we do that too. And it's just things to ponder and think about. You know, I heard a very interesting talk from, I was at Sheikh Qasim's halqa at, I think it was at Redmond the other day, and he was talking about how the way we do zabiha for our meat has such an etiquette around it that, you know, the animal can't see another animal being slaughtered. You have to hide the other, you know, animals that you're slaughtering from the one you're going to slaughter. He can't, the animal shouldn't see your knife, and it shouldn't be in a state of worry when you're slaughtering him. And there must be so much benefit in not having stress hormones floating around in that animal when you're slaughtering it, that you later consume as part of their meat. That perhaps we're being protected from those bad things just by the way we take care of the animal in the manner in which we slaughter it. So when you're not doing like a mass slaughtering of the animal to feed a large, you know, society that's voracious with its meat supply, there's probably inherent protections in our own health from the way we do that. I probably don't have to go into the benefits of avoiding alcohol, intoxicants, and gambling in this group of the converted that's already sitting here, but there is so much expense in society that's put behind trying to bring these factors under control that we are saved from. You know, what about the reduction of infections when we are habitually using water to clean ourselves in the toilet? What about, you know, the similarity I always found interesting in the way wudu is to doing a surgical scrub before you go in to do a case. You know, all of a sudden we're doing the same type of scrub where we hold our arms up and we let the water drain off so that our hands stay clean and aren't contaminated from what we're trying to clean off before we go in to do a case. We're practicing a surgical scrub before every salah to stay clean and pretty much using that type of a sterile technique. And there are many such things that are part of our sunnah that I'm sure we benefit from, and I was going to welcome anybody else's thoughts and ideas about things that I might have missed as well, but it's always good to just stop and ponder about all the benefits that I think we automatically glean from our faith and our teachings. Any other thoughts?
Yeah. My father had surgery in 1979. He had the valve, and what's surprising me, the valve was replaced. It was taken from the pig. The doctor said it was very close and very similar. And now, after with the modern technology, is there the best part to replace that things?
So the most amazing thing, and you know, we know that there were communities that Allah turned into pigs and monkeys as part of their punishment. It's very unique to humans that pigs and monkeys have very similar organ systems. I think one of the first heart transplants that ever took place was a baboon heart, and we commonly use pig valves as replacements to human valves. Even to this day, it's a preferred valve system and the closest in its anatomy and configuration to the human valve. So yes, it's still used, in fact, and probably has the closest in its anatomy to our own even today. And even a lot of the medications that are used in our treatments for things are things that are derived from such animals. So I think it's interesting how there is that genetic similarity.
So also there's some breed behave, but when we get angry, we lay down. Do you see any relationship with that?
Yeah, that's a very interesting point. I actually never thought about that, but it may be a way to just kind of help to stabilize hormonal systems and blood pressure and those things that end up being a little out of control when it comes to anger. That probably helps to settle it down. It's kind of hard to be angry when you're lying down too, so there's definitely just the physical mechanics, I think, of being able to bring that under control. I think it's up to us to think about these things and then relate them. It's probably the way Muslims advanced knowledge in the days when they did, when they use Islam as the basis and then try to understand the workings of the world rooted in that, as opposed to the other way around when we make our discoveries and then try to rationalize it scientifically. I think a lot of our answers are already in our Quran and our Hadith, and we need to learn them and then look for the truth as an explanation of why we do this. Why might this have been recommended, and we can maybe discover other newer things because of that. Thanks. Enjoyed that. Were there any other sort of thoughts or things we wanted to touch on?
I have a question about MSG. I know like people I've been to several places and sometimes you'll see like canister of MSG, like people just scoop or whatever. Is there any benefit of using regular salt or MSG, or what kind of?
So I believe its role is more as a flavor enhancer, and there are definitely people who have bad reactions to it, and it gained notoriety because of that. And I'm sure there are many other products that are similar, but this one's been studied the most because of how many people have adverse reactions to it, as heart rates racing, flushing. I feel horrible when I'm exposed to it, and therefore you get a choice of choosing food that doesn't have MSG in it when you go to Chinese restaurants and things like that. But I'm not sure how well studied it is from the standpoint of its sodium content or its high blood pressure relationships. It was my understanding that most of the adverse reactions have more of kind of an allergic trend to it as opposed to a long-term kind of a hypertension kind of contributor. But it's a creepy chemical when it comes to food additives. I'm sure there's others that are out there that we don't even know or appreciate because nobody's really looked at it or studied it.
About sweating palm, could it be symptoms of weakness in our heart or not?
I'm not sure about the actual palm itself, which probably has more to do with just things like fear, anxiety, or restlessness, and that kind of sensation, when you're going in for an interview and you're all sweaty from that respect. But we do worry about, as part of a symptom complex, of people who might have sort of a problem with their heart circulation. We talk about chest pain, talk about shortness of breath, and as part of those feelings when they're doing something physical or exerting, they may recognize that they're sweating more. So excessive sweating in the context of exerting and feeling chest pain, pressure, tightness, heaviness, shortness of breath can come as a package when we're looking for changes in how we're feeling when we exert. And those kinds of things are good to talk to the doctor about. Because if they start to worry about the health of the coronary arteries, then they'll launch an investigation based on that. Especially things that are new to somebody. Like you're not used to feeling them, and now recently you're starting to realize that these are happening consistently. And then it's good to kind of work with the doctor to figure out if it's something to work up or not.
I found in my family there's some relatives have the chest bone. It's not straight. One side is like look higher than the other. Does it have a relative with the heart problem or something?
No, not so much. There's one that people are born with where the sternum, the breastbone, is concave in. And depending on the severity of that abnormality that people are born with, it can affect how much room the heart has between the breastbone and the spine. And there are certain conditions where it can be severe enough that it can cause impairment. And then when it's discovered, usually as a child, there's certain types of surgery that are done to correct it, but it's rare. From one side to the next, if there's sort of an asymmetry, it's not symmetric, those are probably not as common, and I would imagine there's still plenty of mechanical room in there, and I don't know of any such abnormality that relates to heart disease. Okay. Should we call it a wrap?
Thank you.
Thank you.
Oh, you're so welcome. I don't know if that was that similar to what you guys wanted to hear, or
Oh yeah.
That's a lot of things.
I talk more about risk factors rather than